Over the past 2 decades, most industries have increased productivity by more than 50%, primarily driven by technology. Healthcare, 0 productivity growth. Some of that makes sense. Healthcare will always be high touch and personal, built on people caring for other people. But the size of the gap is extraordinary, and it's preventable. We've all felt it. As patients filling out the same forms again and again, as families waiting on hold for hours, and as clinicians drowning in clicks instead of caring for people. And we've all seen the toll that it takes on caregivers, on patients, and on the broader economy as a whole. One major driver of what you see on this graph is administrative burden. 1 out of every $4 we spend in healthcare goes to administration. Paperwork, approvals, redundant documentation. That's cost without care. And outcomes? Despite record spending, the US has some of the worst in the developed world. Burnout's also at record highs. Nearly half of physicians say they're considering leaving the profession. And hundreds of thousands of nurses are projected to leave the healthcare workforce, just as the baby boomer generation retires and the demand for care surges. Almost everyone in this room surely has their own story of how the system has shaped their lives. For me, it began when I was 3 years old, when my mother, a cardiac ICU nurse, suffered a traumatic brain injury that left her permanently disabled. From that moment on, I lived this system as her son, as her advocate, as someone who saw how hard it was to get the right care at the right time. That experience is what drives me to want to build a better system for everyone. So why hasn't technology closed the productivity gap? I call it an innovation mismatch. On the one side, you have the unique environment and constraints of healthcare. On the other, the mindset many innovators have brought from other industries. Move fast, break things, scale quickly. The two don't line up. And in healthcare, when you break things, you break people. I believe there are 4 things that make innovation in healthcare different from other industries. First, the high cost of adoption. In most industries, digital distribution is fast and cheap. In healthcare, it takes not just capital, but time, training, integration, and boots on the ground. Second, regulation and compliance. Protecting patient safety and privacy is non-negotiable. That's the right thing to do. But it also means navigating a thicket of rules and approvals that slow down even the very best ideas. Third, legacy data and technology silos. Healthcare data is fragmented and locked away. Interoperability is incomplete, and integration is almost always a heavy lift. And fourth, slow validation and complex procurement. Outcomes in health tech can sometimes take years to generate. ROI often accrues to someone other than the adopter, and procurement cycles in large health systems can choke momentum before solutions ever scale. And here lies the paradox. Despite all of this, we have many of the essential ingredients for excellence. We have world-class research, incredible technology breakthroughs, some of the best care available anywhere in the world. But without innovation models purpose-built for healthcare, our best assets will remain trapped, and patients, families, and caregivers will keep bearing the burden. In isolation, that all sounds pretty dire. Now let me make the case for why I think there's a very strong case for optimism. For the first time, we finally have the tools to overcome many of the barriers that have long held back health tech. There have been 3 major waves of technological innovation that have gotten us to this point. The first wave was digitization in the 2000s. It was painful, but it gave us a standardized digital foundation for data, the raw material for everything that would follow. The second wave was the advent of early AI in healthcare. Tools built primarily on computer vision and structured data showed promise, but most of those early use cases were deeply clinical, deeply regulated, and carried very substantial risk at the point of care. Adoption was slow, and scaling was even harder. The third wave is generative AI. Even in its infancy, adoption has raced ahead at a historic pace. And that surge has done something important. It's prepared the healthcare workforce with both the fluency and the expectation that this technology will simplify their work and amplify their impact on patient care. which brings us to now, 2025 and beyond. We're at a once-in-a-generation inflection point, a convergence of technology, need, and readiness. We stand on the precipice of a new golden era in healthcare, a moment where AI doesn't just change what we can build, but how we can build it, transforming entire workflows and making real healthcare transformation finally within reach. Nowhere is the impact clearer than in how companies are being built. Gen AI has collapsed the cost of code, unleashing a new era in software creation. Inside Microsoft, Satya Nadella recently shared that 20 to 30% of the company's code is already being written by AI. Their CTO projects that within 5 years, it might be as much as 95%. For an industry where software engineers have been the scarcest resource for decades, this is transformative. These tools are also democratizing who can build. Platforms like Lovable and Replit, while not always perfect, can let anyone instantly describe what they want and watch Gen AI bring it to life instantly. What once required armies of designers, product managers, and engineers can now be done by small, agile teams. Mark Andreessen once said software ate the world. AI is now poised to eat software itself, with nearly every part of launching and building a company augmented or automated by AI. And for healthcare, the implications are profound. I mentioned earlier that much of the first wave of AI in healthcare was built on computer vision and structured data. That made it well suited for highly regulated clinical use cases, things like imaging and diagnostics. Important? Yes, but narrow, specialized, and often slow to scale. Gen AI completely changes that. Language models are designed for healthcare's unstructured reality. Notes, images, signals, conversations. And when you add AI agents that can automate workflows and even make decisions, the aperture widens dramatically. Values migrating from niche point solutions to system-wide workflow transformation. Now we're talking about tools that touch the front lines of care, streamline operations, and improve the efficiency of whole organizations. These non-clinical, non-regulated use cases can often be quicker to scale, in large part because the return on investment is bigger and much more immediate. So this technology has changed what we can build, who can build it, and how quickly. All of that sounds exciting, and it is. But for health systems, that raises two big questions and two big risks: being overwhelmed by a constant stream of new solutions and sinking time and resources into tools that don't actually move the needle. The issue isn't a lack of innovative ideas. It's whether these innovations can hold and scale. Because in healthcare, scale has always been the hardest part. And the difference between ideas that stall and solutions that endure comes down to one thing: trust. And if scale depends on trust, then the obvious question becomes, how do you build it into the very DNA of new companies from day one? That question shaped how we've designed the Aegis model. When we launched Aegis, it was with a bold hypothesis. Healthcare doesn't have an innovation problem. It has plenty of breakthroughs. So we designed a model purpose-built for healthcare, not borrowed from Silicon Valley, not built at arm's length from the people delivering care. We wouldn't build for health systems, we would build with them, partnering deeply to validate problems and to co-develop solutions. We wouldn't just invest, we would act as co-founders, a craftsman-like approach, much like venture capital in its earliest days when it was a cottage industry. Building only a handful of companies every year, going deep on each one, working hand in hand with founders, ensuring solutions integrate seamlessly into workflows so clinicians aren't left with yet another dashboard that never gets used or more clicks that adds to their existing burden. We then combine that craftsman discipline with the resources and reach of a leading investment platform, ensuring that our companies would have access to world-class resources and support. With the Aegis model, we set out to build a new paradigm for health tech innovation, one designed for the realities of healthcare. But no paradigm succeeds unless it solves the hardest problem of all: not code, not capital, trust and scale. Our first collaboration with Northwell showed what's possible when you work side by side with clinicians, administrators, and health system leaders. The companies we built earned trust because they were built with the people delivering care, not for them. From that experience, we learned that trust isn't accidental. It's designed from day one. And in our model, that comes down to three things: integrative teams, long-term alignment, and outcomes that matter. So first, integrative teams. The strongest companies aren't built by outsiders parachuting in or insiders alone. They come from teams that combine both: operators who know the system and intrepid builders who bring speed and velocity and new ideas. Together, they create solutions that not only innovate, but actually change how care gets delivered. Second, long-term alignment. Too often, incentives don't line up. Investors want quick returns. Entrepreneurs want a path to rapid scale. And health systems carry the burden of adoption. Real trust comes when everyone acts like co-founders, with incentives aligned from day one. So health systems shape the solution, entrepreneurs gain anchor partners, and everyone shares in the value that's created. Third, outcomes that matter. Success isn't measured by usage stats. It's measured by outcomes that patients and clinicians actually feel. Fewer clicks, more time spent with patients, better diagnoses, less waiting, real savings that strengthen the system. Those outcomes earn trust, and once you deliver them, adoption compounds. When you build trust from day one, it becomes an unfair competitive advantage. Trust mobilizes the ecosystem, attracts talent and capital, and accelerates the path to scale. That's the trust advantage, and it's the foundation of the Aegis model in every company we launch. Our first companies built under this model showed what's possible when you create products that patients and caregivers actually need, not solutions in search of a problem. But to truly drive impact, we needed to bring together health systems from across the country. That's where the digital consortium comes in. When I first called David Feinberg with the idea, he told me healthcare needed this, and that if we did it right away with humility and trust, we might have a chance. John Noseworthy loved the idea too, but he cautioned me. Bringing health systems together could take years and would likely move a lot more slowly than I had hoped. And yet, in our very first year, 11 of the nation's leading health systems joined us, a true microcosm of the US healthcare system. That diversity was intentional. If we wanted to solve healthcare's biggest problems, we needed partners who mirror the system we're trying to serve. Our digital consortium partners are who we go to first to pressure test new hypotheses, ensure new companies are focused on the right set of problems, and shape new products as we're building them. The trust in this partnership is what's enabled us to move with more speed and conviction. And today, I'm proud to share that 3 new partners have joined the digital consortium: Keck Medicine of USC, Hartford Healthcare, and Yale New Haven Health. Together, this group now represents 8% of US healthcare, 500,000 employees, and more than $100 billion in operating revenue. Never before has this caliber of health systems come together in this fashion, not just to identify shared challenges, but to co-create solutions, co-invest in their success, and scale them together in partnership. With 5 portfolio companies launched and more than $200 million raised, we've seen great momentum, and the results speak for themselves. 4 or 5 have already advanced from seed to Series A, more than 5 times higher conversion than the current industry benchmark, and the 5th company is on track for this fall. Building financially durable companies matters, of course, but what motivates our team most is the impact these solutions are driving across the ecosystem. Let me ground that in 3 quick snapshots. Ascertain's case management solution cut prior auth time by 67% and reduced clicks by 80%. Hours back to clinicians instead of paperwork. What's fueled that momentum is having providers and payers on a single trusted platform. HumAI's 3rd-generation speech model enables more emotionally aware interactions. In one use case, therapists' documentation time has been reduced by over 40%, helping those clinicians better serve their patients. Optane delivers non-invasive retinal screening that detects more than 10 conditions with over 90% accuracy in under a minute. 7 leading health systems recently participated in their Series A financing, a clear sign of confidence in the quality of the solution. Across these examples, the pattern is consistent: earn trust and adoption compounds. To sum it all up, we've made real progress with health systems, but driving systemic change requires mobilizing the entire ecosystem. Payers shape what care patients can access. Pharma determines what care is possible, and technology provides the rails that allow it all to work together. Today, trust across these 3 groups is uneven. In some places, there's real alignment. In others, it's fragile. We don't have every answer, but 2 things are true. Where trust exists, we should move faster, and where it doesn't, we should rally around the few problems that matter most. Once we've identified these shared problems, the same things that help build trust between health systems and entrepreneurs equally apply here. Build shoulder to shoulder, make sure incentives are aligned from day one, assemble teams that reflect diverse perspectives, and focus on real-world outcomes that matter. I opened earlier asking whether we could summon the trust to rise to the urgency of this moment. That's why we're all here today. Coming together is the first step to building a broader community of practice. Because here's one line I hope stays with you. Innovation in healthcare doesn't move at the speed of code. It moves at the speed of trust. So let's build that trust together for patients, for caregivers, for all of us. Thank you.